although I've not been here for a year, I just want to really say thank you to all of you for all the amazing work that you do in corporate services, and tell you how impressed I've been coming into the organisation and seeing the hard work that you all do and such important work that goes on behind the scenes. And often the work that you do, because you do it well, is not really recognised because things happen and the work gets done and it all runs very smoothly. So I really want to give some messages today just to say, that how valuable your work is and how important it is to the organisation, and it absolutely is recognised by all of us.
It became really clear straight away that yes, we've got pandemic plans, we've got business continuity plans, we've got all sorts of things where we've prepared for occasions such as this. In reality, it was incredibly different for all organisations, not just us. The scale and the challenge faced by the pandemic was not a thing that we could have really prepared for. And what was also apparent was that whilst we have an incident room and a team of people who sit in an incident room, that's just the hub of the activity. It's not where the activity takes place. There are so many people across the whole organisation who were part of the incident response. And we had massive input from estates, from our procurement teams, from our comms partners, HR teams, and not to mention infection prevention and control, who've been absolutely integral to the conversations that we've had to have and to the success we've had as an organisation in limiting the transmission of COVID for both our staff and for people who are on our inpatient units.
Since COVID, staff side have led the way really and making sure that all risk assessments get done, environmental risk assessments, so we can assist people to get back into work. We also support people to enable them to work from home, any issues with management. We visit sites and we're requested to do environmental risk assessments and making sure people can social distance. And we've been working very closely with management and the trust to try and facilitate this. It's just been a really strange year for everybody this year. It's been really difficult. I think the staff at LSCFT have really come together and stepped up.
My teams have had a busy 12 months looking after the hardware and software that we all use in our day-to-day work. In particular though, in the last few months, like with a lot of teams and services, COVID has presented some significant challenges, which I think everybody has risen to in a really positive way. For us, that's involved rolling out a number of laptops, several hundred laptops, but it isn't just about rolling out that hardware. We need to be able to work differently, embrace new ways of working. So alongside rolling out all that kit, we've embraced using Microsoft Teams, getting that out to everybody, and making the ability for people to be able to work in different locations, more home working. So that all had to be delivered in a fairly quick turnaround time. However, the real positive in all that was the way that, because people were all pulling in the same direction, it was a really successful piece of work overall. And I think it's made some lasting differences to certainly me personally and as a set of teams, in particularly the way that working with our operational colleagues to understand what the needs and requirements are and making sure that we deliver them in a coordinated and timely way and that we're getting the best from all that has really been a positive.
I'd like to tell you a tiny bit about how we've had to adapt our training due to the impact of COVID-19 and the pandemic. As you can imagine, face-to-face training initially, but a lot of people were anxious about doing that, and there was a lot of national guidance about not doing it. So we were very, very fortunate in terms of we've got some large space here, and we're also able to actually negotiate with Preston North End and Heathcote that we could actually use their hospitality suites upstairs. That has been absolutely tremendous in allowing us to have social distance training, and that's fundamental. And we've delivered probably in excess of 2,700 people currently, and nearly getting on to something like 300 training courses. We had to firstly realign our training programme, and that actually meant really considering what was important in terms of the training that we were going to do. We came up with some training programmes which were universal, but they absolutely covered the fundamentals, and they were stuff like enhanced life support, which we Again, we changed, so in light of COVID-19, basic life support, so we're covering the deteriorating patients a lot more than we had done previously. And we realigned our moving and handling course, and that was really, really important. The other things that we did was we also created a whole number of video snapshots, bite-sized chunks for moving and handling for different techniques and also for the positively safe. So for us, I'm really, really fortunate. I've got a fantastic team that really, really stepped up to the mark.
During the COVID-19 pandemic, we had to completely revamp the way that apprenticeships are delivered. So we worked with our academic providers to develop online programmes, so all the training is delivered online now. We've also had to change the way that we support our apprentices, so offering virtual application form and interview skills as well. We've had some fantastic feedback regarding our apprentices, so roles such as the trainee nurse and associates and healthcare support workers have been providing fantastic support to our qualified staff. We've also had non-clinical roles as well, who are going above and beyond, helping out in swabbing, ward admin, so that's really fantastic to hear. We've also had a lot of apprenticeship completions as well, which is absolutely brilliant, especially in this stressful time. In terms of career engagement activities, we did used to work with a lot of schools and colleges around inspiring the next generation of NHS staff. So we're really proud that we've recently delivered our very first virtual online work experience programme. This was in partnership with the medical education team, and it has been a real success, and we hope to roll out other programmes in future.
At the beginning of the pandemic, we had to respond really quickly within HR operations, and in order to manage this, we decided to split the team into two. We created a COVID-19 HR response team and a business as usual BAU team. It was an extremely challenging time, and the phone was ringing off the hook straight away, with questions and emails coming in too, thick and fast, many of which we just didn't have the answers to straight away. We had to work at a pace no one could possibly have anticipated, working round the clock to get ourselves organised and in a position to respond. We were faced with having to draft multiple FAQ documents, guidance documents, home working guidance, and a new temporary terms and conditions document, to name but a few things. And we had to keep up to speed with the ever-changing government advice, which changed unbelievably quickly in the early days. We certainly learnt as we went, and we went to bed dreaming of comms and FAQs. We were then also asked to send out all of the antibody results to the staff who had had a test. And with the support of redeployed dental colleagues, we sent out over 5,500 results, which was no mean feat. We are so immensely proud of our whole team and how they adapted to the changes and how flexible everybody was in such uncertain times.
So during COVID, it was really important for us to continue to recruit and do so safely and sufficiently as we can. We had over 100 student nurses that joined our temporary registers and over 30 allied health professional students as well who joined. This was really important so that we can ensure that we could support our services as safely as we could. We had to make a lot of changes in terms of how we do things. So for example, we introduced virtual checks, video interview calls. All of that was quite a big change to the way we normally do things, but it all seemed to work quite well, and also speeded up some of our recruitment processes as well. Additional to this, we've introduced virtual recruitment days. So far we've held 2. They've been really successful. We've had over 50 potential nurses take part. Additional to nurses, we've had allied health professionals and other community posts as well. It's worked really well so far, and we're hoping to hold them monthly.
I just wanted to say a massive thank you to all staff in the People and OD Directorate. Your support, hard work and commitment to improving our services is fantastic. You support each other, you work well together, and most importantly, you live the values of the organisation. During the period of COVID, many of you have taken on new roles, you've worked additional hours, you've worked flexibly to meet the needs of the organisation. Both myself and Helen are very proud of you all. Many thanks.
It's been one of the most difficult times with the current pandemic, and yet things have continued, and that's down to everybody's hard work. We've seen that, you know, the technology that's gone in to support our organisation, support all of our services. Our back office corporate functions have been there to do that, to pay our goods and services and our people for the work that they do. It has continued. we've managed to order goods and services, and that's been particularly challenging with some of the things that we've had to do around ordering PPE equipment in particular. So I just want to finish off just with a couple of things that I've seen over the last few weeks that have seemed to have made a real difference to people. One of them has been the work that the finance function has done to really stay in touch with everybody in the function, and including newsletters. There's been some surveys done just to check how people are, some online surveys that I know everybody's been taking part in finance, and that's given some really good information about how you are and how you're feeling, and I think that's been really important. And I know finance have done an awful lot of work in that area to stay in touch with the people, and I know other departments have done the same thing. I'm just more familiar with what's happened in finance, but I think it's a great piece of work. So thank you for doing that, because I know that people do appreciate that, and I know that it's really important during this time to stay in touch with everybody we've got. But all of you guys working at home to keep our services going, it's just been amazing. So thank you so much for all of that work. We really do appreciate it.
During the COVID-19 pandemic, the infection control team have been very much a much used service within the trust. We've supported colleagues all over. I think we have about 7,000 staff. So we've been involved in setting guidance, comms campaigns, supporting staff with clinical queries regarding COVID positive patients and COVID positive staff members. We've been out on the wards, making sure that staff are wearing PPE properly and appropriately, and trying to support them as much as possible. Obviously it's very different for our clinical staff. It's not something that they've ever had to deal with before. Really, the organisation has come together as a whole. It's been an unprecedented situation, and everybody has really pulled together and worked hard, from procurement, from estates, from the clinical teams. Every single member of the trust has really pulled out all stops to look after each other and look after the patients at a really difficult time.
It's been a busy and productive 12 months for the medicines management team. We've introduced new ways of working and responded at pace to the challenges and opportunities presented by the pandemic. Our East Lancashire team introduced a new model of medicine supply. We were also involved in a pilot of specialist mental health pharmacist input to primary care networks. The start of the pandemic saw us introduce one-stop clinics for clozapine patients, halving the number of face-to-face contacts, and our electronic prescribing and medicines administration system supported remote working for those who were shielding or self-isolating. Our non-medical prescribers ensured continuity of prescriptions where there were medical staffing pressures. We introduced guidelines, new e-learning modules and competency assessments to support care of seriously ill patients with COVID who may also need oxygen. As always, the team demonstrated excellent team working across services and localities in support of each other. Every member of the team should be really proud of all they've achieved in the last 12 months.